all Bonami's family. Great supportive community, close-knit caring family. We're non-judgy, blanket fuzzy, stigma-free. All Bonami's family, friends, family, and community. We all Bonami's family. Teacher sharing is our key. Great big thanks to you all.
Hello, and welcome back to another episode of Stigma Stompers. I am one of your hosts, Abby.
And I'm your other host, Janana.
Today we are joined by Dr. Anne Albaugh. We're talking about a lot of things, child and adolescent mental health, team-coordinated care, lots of just general mental health things, I guess. So I'm going to let her introduce herself.
Well, hello, everyone. I am Anne Albaugh. I hail from actually Meadville, Pennsylvania, and came back home after all my studies to be in this area in Northwestern PA. I am a child and adolescent psychiatrist, double boarded in general psychiatry and child and adolescent psychiatry. And I've been back in this area after I did all my studies at Hahnemann, where I did my medical school as part of a Gannon Hahnemann program back in the day. They had a 6-year program for us, and really to support primary care in Northwestern Pennsylvania that has a lot of ruralness, and it was really quite successful. Anyhow, back in the area from all my studies since 1989.
Oh,
Perfect.
Wow.
Happy to have you.
Yeah, thank you
And thank
so
you for
much.
joining us today.
Yeah, absolutely. So what inspired you to pursue the career of psychiatry, especially in adolescents and children?
Yeah. So I think about in really my development, in my early development, growing up in a family, I had a parent, my mom, who was ill and required time at Cleveland Clinic, and this would have been in the 1960s. And so as a little girl growing up, I had this eye on healthcare and becoming a physician. So if you looked at family pictures, you would see me dressing up my little brother in a nurse's uniform, and I was the doctor. and it went from there. So once I was in medical school and learning about all of the different opportunities that could be in terms of what I was interested in and what was a good fit, I really found that I loved primary care. I loved the rotation I did in psychiatry and thinking about what was the dynamic there. And the dynamic was being able to be with a person or with a family, to be able to listen, hear their story, and a part sleuth, understanding what's going on, what information we need to gather. And that steered me in the direction of psychiatry. And I have an opportunity now to really be respectful of those that I work with and enjoy the work that I do.
Yeah, that's so essential in any career. I feel like if you enjoy what you do, it helps your own mental health if you're enjoying what you're doing. If you don't, you're kind of going into work miserable. And I feel like, especially when you're working with clients, those clients can sense that you don't enjoy your job. So that's amazing. I love that.
So you've been practicing for over 30 years in Northwestern Pennsylvania. How have you seen the mental health landscape kind of change and evolve, especially for children and teens?
So one of the things that I would say is change is sort of the thing that is always there. And looking through the time that I've had here, it's been amazing changes, most for the best. There continues to be challenges, however. So although we've grown the amount of resources that we have and the clinicians and psychiatrists that we have in our region, it is not sufficient. We still have those gaps and those areas of need. However, we really have blossomed in many ways. So when I first came here, we had state hospitals for children. We don't have state hospitals anymore for children. That was significant in terms of the impact it had on families. In order to receive your care, if you needed that level of care, you needed to go through the court system always. So it was an adjudication, what they call an adjudication, where custody was then shared with perhaps Office of Children and Youth or Juvenile Justice. So that was a welcome change when we moved in our system across the state with residential treatment programs and a change in this could be something that a part of the level of care. And so that was welcome. It is still something that's very difficult step for families to take, but they can take that with a voluntary process to say, yes, my child or the child themselves say, yes, I need this care for safety and to be able to receive it. So that, when I think back, that's a major change. I think we've shifted our care to community care. So expanding the level of resources in our levels of care. So, community, outpatient based, and then moving up in the levels of care, if we talk about that with children and adolescents, hospital and residential being the highest, and then there's in-betweens.
Wow. Have you seen a shift from stigma, since you've been in the mental health field for over 30 years? Have you seen any shift in the stigma, maybe even if it's from parents or individuals regarding mental health?
I think that there has been a shift. In fact, some of my colleagues really talk about we should be careful about continuing that, using that in that does it hold us back? That I think that there are many more people now that embrace what I would refer to as whole health care, that you can't have health care without mental health. And so that notion that this is connected and integrated, I think that we still have some work, absolutely, that if we look at the equity of how we provide that care, is there equity across physical health, mental health, substance use? How do we integrate that, and how do we provide equity for that? So I think that we still need to beat the drum around this. I think that there still is that judgmental piece that exists for some folks that, you should just pull yourself up by your bootstraps, as opposed to understanding the impact that depression, anxiety, trauma, life experiences can have, that we have this synergy and integrated space for us in our environment and the environment and ourselves. We learn about that in terms of, what the foods we are ingesting, the water we take, learning about microplastics and where they land. And there's so much we don't know, and yet how do we study this and keep moving it along? So, yes, I think that we've made progress around stigma. We have some ways to go. But there's a lot of challenges to how we think about that.
Yeah, I feel like the stigma surrounding mental health is an issue, but I feel that there's stigma in so many other facets that affect that. And so kind of debunking that, it's just a lot of things need work.
I would use the term the social determinants of health and social determinants of mental health. So we think about poverty, we think about food insecurities, just to name two, and the stressors that family systems experience, where you are not, where you have to have more than one job, the time then that you have available to your family system. All of these things start to impact our whole health.
Yeah, absolutely.
I think it's really important. Moving into more of child and adolescent mental health, what are some of the most common mental health challenges you're seeing today in children and adolescents, and have these shifted over time? Has it always been the most common one? Have there been different ones over the years?
I can offer some thoughts today, and perhaps given more thought, I might have some different answers. I think it's a complex question.
Mm-hmm.
What I do see is the impact that our social media has had on all of us, but on developing children and adolescents and moving into adulthood, and how adults manage their time in caring for in their role as parent or caretaker for children. There's, I think, some tangible stresses in that process of how we've integrated, and I think perhaps too much. So if you look at the efforts now to reduce availability of phones to very young children and iPads that I have right next to me, the other electronics, how do we look at being able to explore the outdoors? How do we look at reading a book? How do we have conversations in mealtime? And our social media 24/7 need for urgent, immediate information or is changing the way our brains and our interactions are developing. And I think it is a space that we need to understand very well, because I think it really has been very difficult when you are a teenager and that is your social connection and your social network, and all of a sudden you have just too much incoming information that is very negative, judgmental, dangerous. It is, and you feel alone and isolated. You're connected but not connected. The notion that we have, I was just aware of this with regard to March Madness. So love basketball, and we love watching the games during the season. The changes in that process for college athletes to be able to be paid for their image and likeness and name, and what also is happening on the front of gambling, and that people can gamble on anything and everything, and that now these young people that are playing a sport, trying to enjoy and be competitive and part of a team and an individual and living their life, get barraged on the internet with, why did you do this? You didn't do that. And it's not kind at all. And so I think that this is an area that has become a space for all of us to try to understand, how do we reel this in? Is there a way to reel it in? So I think on the plus side, you have opportunities like this. This is a podcast. It's going to go out and reach lots of people. So there's this positive side, but I think we have to look at how can we minimize and reduce or protect, educate and support families in this process.
Yeah. I heard on social media
Yeah.
about how there's a lack of third spaces now. So like you have your home life, you have a work life, and there used to be a lot of sense of community, free spaces, similar to kind of churches, which is still there. But there's not a lot of community spaces. So I think people find that online, which like you said is good and bad. So I feel there's just a lot that needs to go into the social media thing. There's a lot to it.
How can you... So if you asked my family, I would often refer to it, this is 10 or 15 years ago, as it was kind of ramping up, and it's a dark alley in some respects. And so how would we protect our families in dark alleys where we don't know what to expect and what's there? How do we help expand those third spaces, being out and about? Yeah.
I think it's a lot of efforts on a lot of parts. Like the space has to be there, but you have to be willing to take children there. It has to be safe there. There's a lot. Everyone needs to be working towards it. And if one person isn't, then it's not going to work.
Yeah.
So, Yeah.
Yeah, no, absolutely. I feel like social media, there's the good and the bad.
Yes.
Like we talked about, you have that community, but I feel like a lot of people have, like, as if there's a veil in front of them. They feel more protected, especially in adolescents and kids, where bullying, at least from my knowledge and experiences I've heard, is easier now online than going up to someone and bullying them.
I would say that in the professional sphere, I have noticed it. So I am on LinkedIn, and I have thought about that as a space for me for my professional work and meeting other people or seeing what's going on in those settings. I find that I am much more careful about how I respond, what I am seeing other professionals in the way they respond has been unnerving at times, because it is not in a way that is holding space respectfully to argue a different point and to be open to hearing different inputs. It is disruptive, and I think at times very harmful. And so, how to help young people navigate that, let alone the grown-ups. I think there is this space where you can say anything, online versus would you do that face-to-face to somebody?
Yep.
Yeah, social media allows for people to be much more impulsive than I think they would be in real life. Much more. That you could type it out and hit send and not even think about it. Where if you're face-to-face conversation, you think about it a little bit. Or if you do say the impulsive thought, you are at least have time to readjust what you said or have a conversation about it.
Correct.
Yeah.
You can see the emotion, you can recognize your own, see the other. It allows for that interplay.
Yeah.
Yeah, absolutely. So you've worked in many different settings like schools, residential programs, outpatient clinics. How do they differ across the different environments, and what are some of the best practices that supporting youth in each one of them?
So I might, thinking about, because there's two parts to this. I think about those levels, those systems that you're talking about really as levels of care. So thinking about outpatient, where you might see a therapist or you might see a clinician or a psychiatrist. It might be partnering with primary care. There might be at another level. We include schools now because children spend a lot of time there. We've been able to understand that parents' time, if they're holding two jobs, it's much harder, and so schools have had to pick up the pace of like how do we support therapy time, and it's happening in schools. So there's that piece. Looking at higher levels of care where we might have in-home services with family-based mental health in our community or multisystemic therapy, kind of catchphrases, but each of them offer in-home resources for families that can also straddle other systems. So they can be a support for the school system and bring that in as the family is able, if they have a need. And in the community, depending on the children and families' needs. And partial hospital, which is kind of a misnomer, it's not a hospital. And so it's still integrating a school space and therapy much stronger with resources of psychiatry. So all of those are very important depending on the person and the family's needs. The things that I think are important across all of those systems have to do with the ability to have good communication, good coordination, good collaboration, and be responsive in a community setting. So I think about it with all those C's. And part of that is how do we help our clinicians with the second piece, which is being family friendly, integrating family, integrating the parents into the treatment, that they are part of the solution. Not for shaming or blaming or heaving more stuff on, but rather, what are the things? We talked about social determinants of health earlier. What are those pressures in the system that have had the system, family system, feel overwhelmed? And so I think that that is an area that I continue to try to beat the drum around. How do we be family friendly? I do hear from some of my colleagues that I don't know how you do this work with children and having to work with the parents. And I'm thinking, well, all of us, even if we're grown up, have parents, and if we have needs, we would want them to be a part of trying to be helpful. And sometimes that's not easy because there's hurts. And again, how do we help with healing and looking for solutions? And I think it is in the way in which we train. And I think we had probably a period of time where we pulled back from helping our clinicians and therapists with that family therapy component. How do we strengthen that? Because I think that is what is necessary in all of those levels of care, as well as being coordinated and integrated.
When you're dealing with children and adolescents, I know there's HIPAA, so there's certain things you can and can't say. Do you run into those problems when you're trying to integrate the family?
Sure.
But the client might not be willing to talk about it?
Absolutely. So it is very important that we have that confidentiality and respect confidentiality. At the same time, I think that sometimes we use HIPAA as a way to find the easy route out. Like, you don't want us to talk to your family, do you? It's all in the, how do we engage the person in front of us to feel that they can share what they need to share about what might be the hurdles? How can we get through those hurdles? There are benefits to having things coordinated and integrated. At the same time, there can be landmines. I've worked with family systems where, there might be a parent or family member that really is struggling, and we need to have safety. So I don't want to miss that part. But confidentiality is important, and then listening to what are the areas of need, and how do we help if it's a youth over 14 in our state, then they have some ability to say, I would like this not to be. And I think it's open to how do we help them understand what are the benefits versus what are the risks of that. And there is a hard stop risk, because confidentiality does not trump safety. Safety trumps everything. And so it is the decider of how we operate and be able to help families and the teen that's in front of us understand. So we need help. If they are feeling that they are going to harm themselves or harm someone else, then we can't sit alone with that. We need to help with partners. And family can be a partner, crisis can be a partner, our hospital teams, the police. There are multiple partners that can be helpful to us. And we'd want to, so it's about educating people at the front end and engagement.
Yeah, that's so essential. A lot of interviews that we've done and personal stories, everyone talks about how much through their journey the support system had helped them. So that definitely makes sense.
We've also heard about how incorporating in their primary care physician, and they will have a psychiatrist and a psychologist, and having them speak to one another. Everyone speaking to each other is important.
It's very important. And for me, I think if we have such prohibitive decisions around, I will not allow you to talk to this person or that person, I will have an honest conversation with that person to say, I then may not be the person that can help you. Because if you tie hands, and and I want to know what are the fears that you have, or intense feelings that are interfering with our ability to work together. But it may be a deal breaker.
Yeah. I think educating people on that is super important. You may be telling your primary care physician one thing about your diet, and then telling your therapist something else, and they could relate. They could correlate. So I think just anyone that deals with your health at all, they need to be talking to one another.
Yeah.
So
it's a team sport, really.
Definitely. Well, I think we covered this. So I'm going to jump. You've held several leadership roles in professional organizations and advocacy committees. How does policy and advocacy shape and influence the field of child and adolescent mental health?
Yeah. So, yes, it does.
It does.
I am a joiner, and I appreciate the collegiality. I've learned so much over time about how to be a better advocate. It is vital. I think when we were talking earlier about the equity of healthcare and voices that need to be heard, but are not always, actually most of the time. And so many of the folks that we care for as psychiatrists and health care profession, in particular mental health, that group has not felt necessarily that their voices can be shared, let alone heard. And so the importance of being able to speak for, with, alongside those folks is really important, to highlight things that we need to change or to strengthen at our county levels, state levels, national levels. Just a couple of examples. I think about the role of access to care, and how do we help support that. And it's complicated. It's not a do this and it'll be solved, or do that and it'll be solved. It's complicated. And we want to maintain quality, excellent care in the process. And so how can we have our voices heard? The understanding from just a small piece in the physician's world, we are growing our medical schools, but we've not been able to grow our residency programs, where you learn the rest and get the proper licenses and certifications for physicians. There's been a bottleneck there. And so how do we expand that, and being an advocate for access to care with increased residency slots? There is efforts afoot around that. So that's just one example, but really important examples around being able to access medication and not have multiple failed first. How do we help with what we know clinically and share that, so that we're not legislating our health care in ways that are detrimental, that you have to have so many hurdles. And that means more deficit to being able to work, deficits in being able to be a functional family member, for what particular reason. So I think about advocacy around early intervention and prevention. That's probably my, if I had my sign up here today, that would be one of the areas. And we know so much. How do we share that knowledge with young people who are thinking about starting families, for families that already started? How do we provide access to adequate, but I would like to say excellent, child care? and have it be available as well. So I know in our community, this is an area where we have a deficit. And how do we advocate for that? What is our areas where our voices count?
Yeah. It's a very difficult question to answer. Because there's a lot of things you can do. You can be calling your representatives, which is really important.
Very important.
And even if you think that they're not getting your call,
very
they
important.
are getting it.
It's so
call
important.
Representatives about any issue you have.
Yes.
Make your voice heard and
Yes.
call frequently.
Yes.
And leave voicemails.
No, I would say that is really what I've learned. And I think when I think about my colleagues and I think about my neighbors and friends, how many of us feel like, is that intimidating or we just don't do it? But we really should know who and become friendly with our we are constituents, so with our legislators. How do we, for myself and others who have clinical knowledge, how can we meet our legislators and be able to share that knowledge, be a resource for them? But absolutely, we should be calling, we should be writing, we should be visiting. And it's probably visiting, writing, emails. Emails might be last, but they're the easiest. It's okay. All of them count. We need to be doing that.
Yeah.
All of us.
Yeah. They are quite literally there to represent us.
Yes,
so
they are.
They can't represent what you want unless you're telling them what you want.
Correct.
So I feel
Silence
like-
is not good
No,
in
yes,
this
not
regard.
at all. Not at all.
That's true.
What are some of the legislative things that you would like to see better support children and families, either just in this area or just Pennsylvania generally?
So I really want to advocate for ongoing support for prevention and early intervention strategies, looking at how do we help with what we know. We know about the adverse childhood events, the ACEs. We know about those. How do we look at each and every one of those original 10 areas that were studied and we know impact negatively on our health, our physical health, our emotional health, lifespans? There's also research that show about resilience. So, again, things are complicated. It's not a one-for-one. But how do we support helping families understand the importance of the relationship around floor time, around, and how do we as a community advocate for that at our state level so that families can access, since we've been talking about daycare, can access adequate daycare so that they are knowing that their children are having steady folks in their life. When we have multiple caretakers, we know that impacts the trajectory of many children, not all, but for many children, that is very disruptive. It interferes with their, what I talk about, that -9 months to 6 years of age, critical period of time where little ones' brains are developing and all the regulatory stuff is starting to happen. And that's the time when children are able to regulate their emotions, regulate their attention focus and impulsivity that we talked about earlier, and regulating how do I navigate relationships, how do I trust another. And when those are off kilter for whatever reasons that are interfering, and some of those are beyond our control. It could be surgery, it could be a deployment of a parent, it could be a lot of things. How do we understand that and its impact and try to get that back on track? Or how do we support families so that we minimize that? And so those are the areas that are really important to be advocating for and looking at change. We can do a whole lot better in that area, and then I think we would see the benefits down the road. So we wouldn't have the need for as many slots in residential treatment because we have strengthened that attachment, that connectivity for parents and their children. And within the community can hold them better.
I have a kind of specific follow-up question.
Sure.
Would you say that this is very specific to that 0 to 6 year, would you say that a longer maternity and paternity leave, is that why that's crucial then? That would be beneficial for children? I think a lot of the time people think that mothers and fathers even just want more time off work, but I don't think they look at how beneficial it is for their children for their development.
It's enormously important to have that steadiness to support the child settling. We know, and this is some of the area of risk for children that, for whatever reasons, are not going to be able to be in their birth family's home. So if there's disruptions for whatever is happening for the parent, and this infant is not safe in that home, when we disrupt that little one, even if it's a planned adoption, that little one knows how to pick that birth mother out in a crowd. That we have data and studies. They know. And so what we also know is that for a percentage of those little ones, there's an unsettled period of time in addition to sort of the typical unsettled period of time that we call the period of purple crying now. We used to call it, which is sort of a normal part of development, and how do we help parents get through that and do that safely and understand it. But little ones that have those disruptions, they're harder to settle, and it incrementally impacts things if we are not paying attention to what are those core ingredients for little ones to thrive and to be able to develop. There's enough other hurdles that are going to send things, and it's always looking at what's good enough and how do we support our parents in this process, because it's a very important job.
I feel like a lot of, I don't know, but I don't want to say issues, but a lot of issues stem from an unstable home life. So that even starts from birth. So I think that's an important takeaway for anyone listening.
No, I agree. How do your roles with the APA and Pennsylvania Psychiatric Society influence your clinical work and vice versa? They
provide education that is lifelong. So for physicians, if I think about, what I learned when I was in medical school, residency, and child and adolescent fellowship back in the day in Philadelphia at Hahnemann, and move forward, there's so much in the last 30 years that I've had to continue to learn and understand. And in fact, ACEs wasn't on the radar back then. It only became on the radar in the mid-1980s into the early 90s with that research out of Kaiser Permanente. So those organizations for me are a source of ongoing lifelong learning and education. It is also a space for collegiality, so meeting folks and sharing stories and feeling supported. This is a very difficult space. There's a terrible statistic right now that we lose a medical school class every year of physicians to suicide. This is a very, very challenging space to work and care for folks. The pressures are enormous. The changes have been exponential, and it is a space that's very difficult. That's a a breathtaking number.
Yeah, it is.
So for me, these organizations have been ways in which I've felt supported. And the advocacy piece, which is really important.
Yeah, I feel like I've heard a lot of stories where medical professionals who are in school to become medical professionals struggle a lot with mental health, because I can only imagine how stressful it is, how little time they have for themselves, because it's a tough field to be in. And then when they're in the field, they're constantly with individuals who are going through different things, and you're hearing different people's stories. So I don't think we think about it every day, but now that you mention it, it's kind of like, oh, that makes sense.
Yeah, we do. I think we've done, we've offered support for police and firemen, that vicarious trauma. I've certainly seen it in workers at the front lines of children and youth and families, where you are seeing families struggling at their worst and unsafe, and having to intervene, and that kind of vicarious trauma impacts a person, and if it's not addressed or supported or paid attention to, one of the things that can happen is you get hardened and you get narrowed, and you lose the bigger picture of things at times. It can also weigh on the risks for family challenges, where you come home and your mood is not at its best, and interferes with the relationships in the family, with substance use. And I would say that we're at risk when you're at the front lines, and the work every day that we do as psychiatrists and physicians in general. And I think that we are looking at how can we change this dynamic.
I've also heard, we trained the Erie Police Department in just trauma, PTSD, secondary PTSD, and then we also trained the Mill Creek Police Department in mental health first aid. And what we heard from both of them is that there's a lot of emotional numbing, so they just don't feel anything anymore. And that trickles into their home life as well, so they're not able to be that emotional, vulnerable side with like their spouse or their children. And that all stems from the traumas that they face firsthand. They see it every day. They're seeing people on their worst days of their lives. And that's not just police either. That's physicians, therapists, everyone in the everyone in a helping field.
Numbing is a way to get through it. It just can't be your only. If it becomes your only way to get through it, and how do we help with it? It's PTSD.
Do you have any advice for individuals who might be listening who may be struggling with mental health challenges, but maybe they're not ready to take that next step and ask for help, or they possibly might be, in denial or thinking like, I've got this, I just need to toughen it out. Do you have any advice for those individuals?
Yeah, it's easy for me to say it. It's much harder for people to take steps. I think about so for that person that may have a hard time taking that next step, if there's anyone nearby that can walk with them in those next steps, I think is a way to, so for the person themselves to try to be open enough, be able to trust enough with perhaps another person to be able to make that call, take that step. We do have now the 988 system, which is, has still its learning and growing challenges, but we have it. I would say it's really important to believe in oneself and to trust enough that, yes, I can ask for help, and I can take that next step and accept the help.
Yeah, absolutely. That's wonderful. And
that it is okay. For all of us. We are all human and, vulnerable.
Yeah.
It's all part of the human experience.
Yeah. I love the saying, it's okay to not be okay. Abby actually created a t-shirt on our t-shirt store that says that, and I feel like a lot of people love that because it really is. You don't have to have everything together and be perfectly fine all the time. Sometimes it's okay to cry. It's okay to break down. I mean, it happens. It's life.
Yep.
So, yeah.
So moving into kind of talking about the rural community, you serve as a program director for the UPMC Rural Community Psychiatry. My goodness.
You're doing fine.
Fellowship. That word for some reason really gives me problems. What are some unique challenges and rewards in practicing psychiatry in rural communities?
Oh, so many rewards. Let me think about it. So we live in a rural area, no matter what the definitions are, because everybody has a different definition and saying, oh, well, that's not rural. I'm like, well, okay. We have our lovely Erie city that is rich with many things, but quickly we can be out to rural communities, and the space we certainly learned about the difficulties in being able to be accessing the internet when you are rural. Transportation becomes a major challenge. Being able to get your groceries, all of this, there is more distance between you and somebody else, and how to stay as a community. And so at some points, there's maybe increased isolation, but at other times, I'm amazed at the rural connectedness where they look after each other and know where they're at. So it is this space that I am very respectful of and continue to learn about. One of the ways in which I've done that is connected with the American Psychiatric Association has a caucus system, and I belong to the rural psychiatry caucus. And so I've met physicians that work in Alaska with indigenous populations, and folks in the West, in Wyoming or North Dakota, and here in Erie. And we share information and share stories. The training of folks, we want people to be able to understand the environment wherever you practice, but to be able to be respectful of if you are the one that's being, now that we are, past COVID and we have this virtual, digital way to reach out, it can be positive, but it can also be not on the mark, where we have folks being beamed in so that you have a clinician or someone that is going to be providing therapy or overseeing medication. But if they don't know enough about or are curious and understand the environment that they are working in, because they're not living there, it's going to be harder. People will not trust. And so it's really important, how do we respect those spaces and learn about them and understand them. And so that's part of the work that goes on. I've had the privilege to work with a number of physicians and nurse practitioners and physician assistants that are interested in providing care in our rural region. And so they've been a part of learning more about community mental health, and community defined as Erie City, but also the countryside and what that ruralness might look like in Elk and Potter and Crawford and Warren.
Yeah, absolutely. Why do you think it's important to invest in training future psychiatrists for community-based and rural work?
Well, access. That's where people live, and we want them to thrive. And if they have needs, we want to figure out how can we respectfully engage them, be curious about what is their hurts and understand how to develop that treatment plan and be able to make those connections and problem solve if there are things to problem solve. And doing that at the community level is most important. It's much easier to get things started earlier. How do we help them organize? There's some really neat things happening in the space of community support. One of those, I'll give a shout out to an organization called Visible Hands. It is out of Pittsburgh, but I have that connection. This is a wonderful resource that I have as director of this program. I have links and connections to folks down in Pittsburgh. That Visible Hands group is bringing an intervention, ICT, integrative community therapy, which is not requiring somebody like me to be there and give a diagnosis. You don't need a diagnosis. It is about how people come together and share ideas about the little things that are troubling them. You don't have to share all of the other big stuff, but if you can start to handle what are the day-to-day things, how do you feel supported, that somebody is listening, that you are being heard, that you are sharing some joyful time, but also problem-solving time. I'm not doing it a service, but it would require a whole nother podcast. Keep in mind,
have you back.
I might bring a friend. It is a very neat process that has been, the effort is to bring it to the United States from Brazil, where it was developed. In favelas, which are very, very, very poor sections of the country that have many, many people living in them, and different healthcare teams would come in for a day to care for their health, and they began to see how just in that line there were people that supported each other that didn't necessarily need all of what was going to be at the healthcare team, and that makes a difference. And so these are folks that there is a facilitator, and but it doesn't require a medical degree, it doesn't require a nursing degree, it doesn't require a therapy degree, but you can host these community group supports. So, yeah.
I love that. Peer support is very powerful.
It's very powerful, and we underutilize peer support. We underutilize groups and the power in groups and that group support. And, we talked about that isolation. How do we bring back that third space and that collective kind of support?
I feel like a misconception about peer support groups is that you need a formal mental health diagnosis for them, and you don't. You just can be a human living, and you need to talk to someone. It's as simple as that.
I've attended a few of our family support and peer support groups just to see how they are in the beginning when I started working, and I can't even that was my first time ever attending any support group, and just, I guess it's in the name, but the support you get is so amazing, and people bouncing ideas off of each other. I mean,
and it's people that were once strangers and now they're family to one another. It's so cool
because you connect on the things you're going through. It's even though it's a different story, it's still a struggle that might be a little similar to what you're going through, because I feel like a lot of times when we're struggling, we feel alone. We feel like our problem is the only problem, nobody understands what we're going through. So I think support groups are so essential.
Another that comes to my mind, and when you were talking about sort of being the new person to attend, I had that experience with the Erie City Moms. So I had the opportunity to be able to attend one night because they wanted, we were going to be presenting, but they welcomed us to their whole evening. And it's a group of women that have been meeting together to support other moms. They have the ability to care for the children. They feed the children. They have activities for them. The moms can be separate to be able to meet with each other, to meet somebody else that helps grow your natural supports when you were feeling alone and isolated. Feeding you, it's an environment that is just welcoming and so powerful.
And you can find that at support. I feel like raising children takes a village, but it doesn't have to be a biological village. It can be strangers that you meet at a support group.
Yeah.
And you don't even need to have kids to need a village. Everyone needs a village.
Yeah.
So yeah,
everybody does.
Yes.
Still talking about the mentorship program, what do you hope your trainees will kind of take away from it?
Yeah, my hope is that in that year-long effort, and they each pick a project that they work on, and those have been very interesting over time. My hope is that they take that experience and apply it into the future as they continue their work. My hope in community mental health, because I need people to be happy with their work, engaged in their work, interested in lifelong learning, and being accessible to those in need, and to be that community glue and that's available. So, and some of it is nuts and bolts. Understanding how do we pay for this. It's important. It gets back to advocacy and can we make this different? How do organizational structure work? So those are the kinds of things that I am hopeful for. And the other thing that it is nice is that this, when you're an alumni or a fellow, you are part of a group. So we work with the Pennsylvania Psychiatric Leadership Council. And there are actually 4 community psychiatry fellowship programs in the state. And so I'm one of 4, and that group also meets together, and we put together conferences twice a year. And so it is building a community that supports you in the work that sometimes is very difficult when you have all these rules that just feel like they are working against what you need. Yet you've got to get through it. You've got to help the person, and you've got to also keep yourself in a hopeful place.
No, absolutely. That is crucial. So moving on to things that parents or teachers can look for, what are some of the early signs that parents or teachers could look for in children or adolescents? And then what are the next steps that they need to take to help that individual who might be struggling with mental health?
So I think one of the key factors is if you notice a change, when there's something different in your gut, like there is something different going on, and it might be that they are more withdrawn, silent, moody, sleep disturbance, appetite disturbance, but change and trying to understand that and think about that. I think the other is to be aware that when there are transitions and changes for a family system, those are not always welcome. They can be welcome and feeling mixed at the same time. So moves, losses, those kinds of things that could be seen as disruptive. I think sometimes we as a community and as a society become numb to, well, it's just my parents separated. Well, it's just. And not seeing those as potentially traumatic or open to, can I hear more about how you're doing with this, and being open to keep the communication open. So that's within the family. And I think if there are concerns, then going to your primary care physician is one avenue to ask for help or to seek out some information. Another is to go ahead and seek out a therapist or an appointment with a mental health provider in the community. Participate in the programming to educate yourself. So if the school is offering, we have community schools now, what a rich resource for our community to have. Participate in those if you're able to. And I think this is where, how do we support families to be able to find the niche to do that? I look back on raising 3 children and I go, how did we do that? We did it because we had some natural supports.
Yeah.
And so how do we support families in that? But the change, and if you are concerned and worried, and it, how are they doing at school? How are they doing? Did they withdraw from something that they really loved? And you see that pullback. Those are key things. And if you start to see that, maybe you start to think about your own timeline as a person and as a family and as that child's timeline. Are there changes? Is there an anniversary? These are all critical things that are important to capture, because I think that there's connections. As we know, Bessel van der Kolk says, the body keeps the score. And
Yep.
and so it reminds us. It reminds us. And,
Yeah.
Yeah, no,
that's
I
really
agree.
important. And I feel like even if your child isn't, maybe there's not like a major change, but just checking in and keeping open conversation. So that if something little does shift, you're able to pick up on it.
Yep. And you
Because
can
it could be tiny, and there could be no change at all. But
correct. And you can inquire, to be curious, to be naturally curious, as opposed to, don't be like that, or, to just wonder with them, gosh, you're a little off today. You want to talk about anything, something go on. Keep it open and be available to listen.
Yeah, curious rather than accusatory.
Yes.
Yeah, I think that's
Yeah.
important.
Yep.
You don't want them to feel like they're in trouble.
No.
Because
You want to keep this open
Yeah.
to hear. And that means for you to not take things as a parent, so that you part as the grown-up, not to take things personal. That you're only in charge of your own feelings. So if somebody else is really angry, if that little one is really angry and they're throwing it at you like you did, you don't have to internally accept that. Again, be curious and open and try to manage the intensity of your stuff. And sometimes, perhaps what is necessary is maybe that is a clue to say, could I use some help? How can I manage this so I can be open and available and be able to listen to what is going on for my child?
I feel like learning and growing as a physician, it's equally as important to be learning and growing as a parent. And I'm not a parent. I don't have children, but you have to learn and grow with your child. So you may think it's going to turn out one way. It never will.
Correct.
It never will. So just be adaptable and grow with them. I think it's important.
And I think that therapy in general, talking to someone, is so essential to everyone. I mean, getting that help, you don't have to necessarily be struggling, but you might have like daily stressors, like work could be stressing you out. That's something to still be able to talk to someone about. And the nice thing about therapy is it's a third person who's unbiased. They don't live, in your daily circle to know what's going on and choose sides. I think everyone would benefit from seeing a therapist. So,
Yeah.
I will just put my 2 cents in, yes. And it was helpful. It helped me get through medical school and residency and manage, the anxiety and the stressors that I was experiencing.
Yeah.
Quite helpful.
Still continuing talking about supporting children, what are some of the roles that schools and early intervention programs play in prevention and long-term support for those kiddos?
Yeah. So I think, just practically speaking, I want to give kudos to those that are saying in school settings, we're going to put your phone in a safe place so that you can attend school today and be fully attentive to your schoolwork, and our teachers to be fully attentive to you, and have this environment so that we can learn, because this has been a distractor, and so I really appreciate that simple structure. I think it remains hard because we use the internet, and we use all our iPads or Chromebooks as part of the school day. And so again, how do you manage this? Thinking about early intervention, I think really across all of these, we could say it for early intervention onward, steadiness and consistency in the people that are crossing our children's path is vital. So when we think about how do we help our workforce be ready and available to the children that they are going to be charged with care, and we need to pay attention to our workforce. Does the workforce look like our community? How do we support their growth in the work that they are doing? How do we value it? How do we look at recruitment and retention? And retention is vital. I don't want 6 caretakers crossing the child's path when they're 2 years old in a little daycare, unless those 6 are the same 6 all the time, and they've got a nice team. But if you've got 6 different people through a school year that are the folks that are looking after, that's a problem. That is a struggle for the little one and for the environment. So how do I think we need to pay attention to our workforce, and our workforces are also parents. So they're kind of getting the whammy at work and the whammy at home if they're in that universe of caring for children.
Yeah, we need to take better care of the people caring for us and our children.
Yeah, that's true.
For sure.
What are some of your favorite resources that you typically refer individuals to, whether that be students, children, or adults? What is the most used resources that you recommend?
Gosh. Wow, it feels like I'm not sure how to think about that. Well, so I'm going to approach it if someone calls me or is asking me what should we do or where should we go. I think about number one, this just speaks to the way we have our healthcare set up, unfortunately, and that is, do you know what your insurance covers? Because the practical matter is, can you afford this? That's a reality, and it's a painful reality to say that out loud, but that is. So understanding, okay, do you have, is there an employee assistance program if it's the grown-up? And even if it's not, sometimes you can get more access to things if you have the parent kind of check into that and then look at, how can I help my child? But understanding your insurance, understanding who's covered in that group. And so it's outreaching. And these are things that families aren't necessarily comfortable and have time to do. I think about primary care physicians, because they can be helpful in making those connections. I do teach the residents and those that are in my purview with the fellowship to think about NAMI, actually, because it is so underutilized, and you have such wonderful resources, and I want it to be full and robust, and I think it is getting full and robust. However, I think that people don't think about that. So, if somebody is showing up in the emergency room, or somebody is coming to you for the first appointment, and you are already identifying concerns, this is a resource that people can access. I do have a list of community resources that we have. We have strength with, I'm not going to be able to name them all, so I don't want to name any of them and leave somebody out.
No, you're totally fine.
So, thinking about if I think that it can be a therapist, or if we can tap one of our community providers, then I try to help them navigate that and not be discouraged, and be open to, if somebody has a wait list for what you're thinking, then let's look at what are these other options. We do now have virtual options.
Yeah. Absolutely.
So I do think of all of those. I don't know whether I think the one that is, unfortunately, the one that has to drive things is like the insurance.
Yeah. I will say one of the greatest things I have realized for insurance is if you're able to create an account through the app, most of the time you can actually see who takes your insurance and if they're accepting new patients, which is wonderful. It's been life-changing, because sometimes you're on the phone forever with insurance, and then you're like, hey, how about this doctor and this doctor, and you can't get that information. While on the app, if you have that opportunity, it's just right there in front of you. They have their phone numbers and everything.
And that, to me, is part of how do we help educate folks around that, what to do and how to do it.
Yeah.
I think as well, how can we educate parents around what to do and how to do it with monitoring, or thinking about access to the internet, and putting in the safety features that children know more about than the grown-ups.
Yeah.
And I would include myself in that. Like, we need a regular class that says, how do you do this?
Yeah.
I listened to a podcast the other day, and kids are getting so advanced. And this individual was talking about how his mom had an app on her phone, and she can shut down all of his apps on his phone, when he was misbehaving, or it's time for bed and whatever. And I guess he got so frustrated the one time, he actually took her phone and put the same app on his phone and shut down her apps.
A child?
He was a child at the time, yeah. And I was like, they will find ways, unfortunately.
Sure.
Yeah.
I feel like they're not credited enough. They're so intelligent.
They are, and I think that's where, how do we meet them with joy and humor and connectivity, as opposed to, so really working from that positive, strength-based universe. And so it's very important to bring them into the conversation, and then look at, how do we brainstorm? Okay, so if we are going to limit this, and we're going to put our devices over here for charging at night, they're not going to go to your rooms. Same with TVs. I do get in trouble with this all the time, because this is my public service announcement for anybody that has children. Please do not put a TV in your child's bedroom. You shouldn't have one in your bedroom either. The TV should be out in a community area, and everybody can make use of it, but not in your bedrooms. So how to have those kinds of healthy conversations, so it's not just so rule-based and punitive, but it's really about growth and learning. How do I manage all the incoming? Or how do I take a breath so that it's not overwhelming me and harming me? And how do we help our parents understand that and be able to carry on that conversation?
No, absolutely.
I feel like team coordinated care goes into more than just mental or physical health for children. So the social media aspect, and trying to put parameters on their phone to keep them safe. Like, explain to them why they need to be there. Explain, like, I know some people think that those conversations are too heavy for children, but they understand way more than they're credited for. So just explain to them, like, here's why the internet is unsafe. Here's why this needs to be on there. It's as simple as that. Just keep them involved in the conversation.
Unfortunately, I agree. I feel like you have to show them the harsh reality of what could happen and why you're
And you
taking
can keep
those
that
precautions.
conversation age appropriate. You know,
Well,
it doesn't
yeah,
have to be like,
of course,
Yeah.
yeah.
but I think it's important to explain it.
Yeah.
No, I agree.
It is about listening and being open to having the conversation. So listening requires people to be actively listening on both sides, and that's an important practice and skill.
Yeah.
Definitely. Well, a couple more questions for wrapping up here. What gives you hope as you look at the future of child and adolescent mental health?
Well, I think you were just referencing that children have such a capacity for, learning and we tend to think of them as, shh. But how do we look at bringing their strengths to bear to our universe? Hope is so important. So if we have in our workforce for healthcare and mental health care folks that are not feeling able to hold hope, then we need to help them because that is our job. From my perspective, our job is to hold hope when people are feeling at their worst or overwhelmed or not sure what to do. That we do need to, and we don't have to know everything. We can say, gosh, I don't know that. But again, how can I help make that connection so that we can get the answer? And we'll figure it out. We'll ask somebody, whether that's my friends at Erie County Care Management or wherever. We will figure this out and we'll find a next step and walk with that person. So holding hope is really about helping us be careful around our biases, that our biases can sometimes then lead us in paths of being judgmental, using harsher language, not being as engaged, engageable, that do it this way or the highway. There's not. So it is in that interface that I think we need to be looking at how do we help our workforce with those tools? And if that exposure that they may have is interfering, how do we get them support? It is our job to be holding hope.
Yeah.
Definitely.
Is there a particular story or moment in your career that reminds you why this work truly matters? And of course, I know with confidentiality, you don't have to give us names or anything, but if there is a specific moment.
Oh, gosh. Well, I think about my opportunities. I think of too many stories, actually. So there's, it is always wonderful to see folks thriving. And what I'm thinking about is this theme of hope. So for a number of years, I worked at a partial hospital for little ones for early intervention. So they were 3 to 5 year olds, and so they were in a preschool environment for their intensive mental health. Their day, and their families were a part of our work with them and helping the family and their little one. Because usually when the little one is out of sorts, the family is out of sorts, perhaps in some way, shape, or form. So it was in that where helping the team understand this whole concept of connectedness and attachment disruption. And the little ones, when I would come to the classroom and there would be new little ones in the classroom, and I would sit down at the circle time in the morning, somebody that was just admitted, and they would like climb into my lap or climb like if they could climb into me, that would be what it was, is that they were seeking that connectedness. We use terms like manipulative or attention seeking, but no, they were seeking connectedness because things in their life were discombobulated. It's that child that I have to help our community members understand that's not typical connectedness. That is a confused, I don't know my boundary, is this a safe person or not, connectedness. And so really helping those children and those families in that space and helping our workforce in that space, because very often I would hear folks say, oh, they have a great attachment. They came right up to me and gave me a hug. I'm like, oh no, that's bad. Yeah. They're not checking with their trusted person to say, are you safe? Who are you? And so that connected, good enough attachment space really is where the little one checks in with the parent before they would, so they wouldn't be, if there's a new person that comes into the room, that child is not going to be the first up and checking out who that new person is. They would do it in a very different way. So it's looking at how do we shape that whole system to help understand what it is to have that good enough connected attachment that allows for all the developmental regulatory stuff. And it was something that I really was trusted to be able to be a part of. And so all of those little ones, I just think, how do we help those families understand that the hurts that they didn't think were hurts were actually hurts.
Yeah. Aww,
and be able to heal from that.
Yeah.
I love that.
Talking about this is our final question, involving the community in children's mental health. For those who want to make a difference, what's an action that they can take today to support that?
One action would be to outreach to their legislator to say we need significant support for our workforce for adequate daycare, preschool teachers and staff.
Yes.
We need to start early. So if I want to put my hat in on the early intervention prevention, and as part of that, we need to support parents with their ability to be caretakers for their children. So how do we support them in their work? And it is a integrated dynamic. You can't have a steady workforce that is productive when they are not able to access adequate childcare.
For some reason, I don't think people understand that. People's children will always be their priority. Children work 100% of the time. So allowing them to not have to worry about their children when they're at their job, it's like a no-brainer. I don't know. I don't know where the disconnect is.
and I think we are, as a community, I'm hopeful. We have the Jefferson Education Society and a couple of other folks that I will be not able to recall right now have worked on some white papers and outreached in our community to the employers to understand this dynamic, the importance of it, and what can we do just for even the city where we are, I think the last, and it's a couple years old data, I think it was 1,500 daycare slots that we would be under for the under 3 children in our city community. So how do we have that kind of robust workforce environment, healthy family system, because they are linked.
Yeah. Well, thank you so much, Dr. Albaugh, for joining us. We truly appreciate you sharing your insight and expertise. I know you're busy, so we can't thank you enough for joining us today and sharing everything. So. Oh well, this was fun, and I just appreciate all the work that NAMI does.
our
Thank
Erie
you.
Thank you.
affiliate. Yeah.
We're small, but we're trying.
Yeah.
Small but mighty.
Yes, exactly.
So yeah,
Thank you.
Thank you again.
We appreciate it.
Thank you to anyone watching or listening at home, and we'll see you next time. Bye.
Bye. Thanks for joining us on this episode of Stigma Stompers Podcast. We truly appreciate all your support.
If you want to see more about what we do in our community, make sure you check out our website. It's namierie.org. Make sure you also click on our t-shirt store tab so you can buy a t-shirt. We get a portion of all the proceeds. And make sure you sign up for our newsletter. It has all of our programming and event updates.
Another way you can get involved is if you feel comfortable sharing your personal story. You can email us at info@namierie.org, or you can give us a call at 814-456-1773.
Thank you for tuning in, and we'll see you next time. Bye!